Assalamu alaikum. Today we will discuss AKP clinical case number 5. This is a case that I believe every pediatrician encounters frequently in their practice. It involves a 1-year-old child presenting with symptoms that at first glance appear to be a viral illness. However, upon further investigation through blood work, we find a more complex picture emerging. I will walk you through the details of the case, the clinical findings, the blood result, and how we arrived at the diagnosis. Let's review the case. This case involves a 1-year-old Caucasian boy who has presented to the emergency department with fever, vomiting, and a skin rash lasting 2 days. These symptoms are suggestive of viral illness. However, due to the presence of rash and fever, additional blood tests were ordered to rule out any underlying condition. The blood test results are as follows. HB 90. This is lower than normal, indicating anemia for this age. MCV 70, indicating microcytic anemia, meaning that the red blood cells are smaller than usual. MCH is 20, indicating hyperchromic anemia, where red blood cells have less hemoglobin and appear paler. MCHC shows 28 gram per deciliter. That is, this also suggests hypochromic anemia. Next, ferritin, that is 42. This is near the lower limit of normal, which could indicate low iron stores. Reticulocyte count is 20, slightly low, suggesting that the bone marrow is not producing a large number of new red blood cells in response to anemia. So from these results, we can conclude that the child has microcytic hypochromic anemia. This type of anemia is typically caused by iron deficiency, especially in infants and young children. Having reviewed the details of the case, let's now address the first question to understand the most likely cause of the low hemoglobin in this child. Answer is E. Iron deficiency anemia. Iron deficiency anemia is common in young children, particularly when their diet is low in iron-rich foods. In this age group, iron deficiency is often associated with high cow's milk consumption. Cow's milk is low in iron, and excessive intake can also irritate the gastrointestinal tract, sometimes causing microscopic blood loss. So in this child's blood work shows sign of microcytic hypochromic anemia evident from the low hemoglobin MCV, MCH, and MCHC values. This result, along with the normal ferritin level, suggest iron deficiency as likely cause. This type of anemia often results from insufficient dietary iron intake, common in young children, especially if their diet includes cow's milk, which is low in iron. Other causes like acute leukemia, hemoglobinopathies, and anemia due to infection are less likely based on the lab findings and the child's clinical presentation. Now that we have addressed the most likely cause of low hemoglobin, let's move on to the next question, which focuses on the investigation needed to confirm this diagnosis. The answer to the second question, which of the following will confirm the diagnosis, is C. Repeat serum ferritin in 2 weeks. So ferritin is a measure of iron stored in the body. In the context of viral illness or other inflammation, ferritin can be elevated, which may obscure a diagnosis of iron deficiency. Once the viral illness resolves, repeating the ferritin test after 2 weeks can help determine if ferritin level remains low, supporting a diagnosis of iron deficiency anemia. Other options here can be ruled out as follows. Bone marrow aspiration is wrong. It is invasive or not indicated unless a more serious diagnosis as leukemia is suspected. Liver function test not revealed in diagnosis of iron deficiency. Stool for cult blood typically used to investigate blood loss. There is no indication of gastrointestinal bleeding in this child. And thyroid function test not relevant for diagnosing iron deficiency anemia. This case shows how important it is to think about dietary causes in young children. Infants who consume large amount of cow's milk are at risk of developing iron deficiency due to low iron content in cow's milk and potential for blood loss due to cow's milk protein intolerance. To help prevent this, it is important to give children iron-rich foods or to use iron-rich supplements if needed. If you have any question regarding this case, comment below. Thank you for watching. Like, subscribe, and share.